The federal government has inaugurated a 23-man technical subcommittee on sanitation and hygiene to consolidate the fragmented piece of sanitation policies into a comprehensive document addressing all aspects of water, sanitation and hygiene in Nigeria. The Director of Water Supply and Support Services in the Ministry of Water Resources and Sanitation, Dr. Nicolas Madu, made this known during the inauguration of a Sanitation and Hygiene Technical Subcommittee of Nigeria National Wash Policy Development Committee in Abuja. Madu, who says it is high time sanitation and hygiene were given the same level of attention as water supply, assured the members of the subcommittee of her support as they carry out their duties.
There's a need to pay additional attention on sanitation and hygiene, so we can bring them at the same level as important as water supply. So we have realized in the wisdom of the global committee to allow the sanitation subcommittee additional time, additional impetus, and additional room to discuss, to attenuate, to gather together, and talk more robustly about issues of sanitation and hygiene so that they can be able to advise and support the main committee. In the past, we have had pockets of policies, not aggregating the entire wash. We have had sectoral policies in water supply, small policies in sanitation, policies in hygiene. Now, the idea of this committee is to develop one very well thought out document, policy document that will aggregate all the shades of wash so we can have everything under one umbrella.
Sanitation and hygiene is very important. When you look at it, you talk about wash, but you say sanitation and hygiene. This is preventive health. It's preventive health. When you have adequate sanitation and proper hygiene practices, then the visitation to hospitals will be reduced, our workforce will be healthy to work, and then it will tell on the economic development of the nation. So it's very key to our economic development as a nation.
If you look at WASH, is water, sanitation and hygiene. And if you talk of water, Ministry of Water Resources, they have a major role to play in that angle. We talk of sanitation, that's the core work of Ministry of Environment, and we talk of hygiene, which is the Ministry of Health. So the WASH, that is why the three ministries are coming together to have a comprehensive WASH policy, so that every ministry's role will be clearly defined, and the three ministries will work together in this area of WASH. So when you get the WASH aspects in Nigeria, if you get it right, the Nigerian public health will be highly promoted and hospital will have less to deal with.
If people have no water to drink, to wash their hands and to keep themselves clean, disease burdens will increase, people will fall out of school, children will fall sick. The economic burden of curative medicine rather than preventive will draw resources into things that could have been prevented, that could be invested in other things, and that slows down economic. If you are treating diseases you can prevent, which is usually more expensive, then you have less money to build schools for roads and other things. Prevention is always cheaper than cure. It also allows you to prevent diseases so that you can have resources to put in other critical sectors of the economy that can then drive growth. So for that reason, water, sanitation and hygiene is very important, both in water supply and sanitation, which has to do more with toilets, how you manage our wastes, and of course hygiene behavior. And if we do not drive sanitation advocacy to the point where government is planning in such a way, we're going to be leaving some people out. People with disability need to use toilets. They cannot use it. You have to build it in a way to accommodate their rights and their well-being. So this subcommittee is supposed to interrogate such deeper issues, technical issues, that will ensure that the national wash policy that is being developed properly aggregates those robust and deep issues to become policy issues, because it's from there you begin to plan, it's from policy you begin to invest resources, it's from policy you begin to prioritize what to invest money in. So the policy is key, and if you don't get these things in the policy, then you cannot have budgets for them, and you cannot then have them implemented to affect the lives of everyday people. And so the idea behind this committee is to make sure that that happens, and what sanitation and hygiene does not disappear as we talk about the broader issues of dams, the other issues of boreholes, of waste treatment plants, those kind of things that politicians want to point out and say, this is what we did. Nobody wants to talk about building a toilet in a market or in a park, so that when a woman is pressed, she's comfortable, that her dignity will be there, she'll have the privacy she needs to be able to use the toilet and not contract diseases and begin to spend money to treat sickness because you use the toilet.